I'm Satya. I'm a M1 at Case Western in Cleveland, Ohio. For the undergrad and pre-med portion, we're going to be talking a little review of what IR is if you weren't able to catch the rest of the conference, and then some tips for medical school, and then what to do if you're interested in IR as an undergrad or pre-med. The next slide. So a little overview of what IR is. Vascular interventional radiology is its own clinical specialty. It's minimally invasive surgery, not just imaging. It's very clinical, so you have preoperative care with your patients, you follow up with them, longitudinal care, and it's really well suited for people who love clinic and working with their hands, doing surgery head to toe. It's very multidisciplinary, so IRs do procedures like Y90, where they might have to work with hepatobiliary colleagues, vascular cases where they might have to work with vascular colleagues. And there's room for subspecialization within. We discussed this a little bit in the international panel, but there are providers doing just interventional oncology or just PAD work. So if all of that sounds interesting to you, then IR is a great field to go into, and it's really rapidly growing. It's a 6-year residency after medical school. So on the right, I have the diagram for the integrated pathway. There's a couple options to get in, but the integrated pathway is the main pathway right out of medical school that you would match into. IR is also very competitive. JVIR actually published an article a couple years ago ranking IR out of medical school as the most competitive specialty. But even if you do a basic Google search, you'll find IR is listed up with other surgical subspecialties. And the range of procedures IR does is too much to count. I mean, you can try to look it up, but if you were at the case competition last night, you know that IRs can get really creative with how they approach procedures. So it's a really great field from that standpoint as well. The next slide. So talking about medical school, there's two main things to talk about: applying and getting in, and then what to look for in a medical school. So for applying, obviously focus on GPA and MCAT, but this is also a great time to incorporate other classes into your coursework. IRs are very innovative. We are on the forefront of technology, and there's also room to be in business and have an outpatient practice. So if you're interested in those fields, maybe take some biomedical courses or some business courses. Research and clinical experience are great ways to build your medical school application. For research, find something that's interesting to you with deliverables. Those are things that could help you get into medical school and beyond. Mentorship is also great. You'll need letters of recommendation. So building those longitudinal relationships with providers or professors early on is really important, and those could also carry on past medical school. The last thing I'll mention, when I do interviews for case med school, one thing we always look for is that the application is kind of cohesive. Students have a narrative, not just activities that are checking boxes. We don't really understand why they decided to do that activity. So keep that in mind when building your narrative. Talking about MCAT, having a dedicated study schedule or plan is a great way to prepare for the test. It's going to be the first of many standardized tests, and it's a great way to build those study skills that'll help you for medical school and beyond. In terms of what to look for in a medical school, cost can be a big factor, but it's very individualized. Curriculum is another factor. I know at UCLA, they have a 1.5 years preclinical and a year for research. At Case, we have a standard preclinical, we have required research. Case doesn't do any cadaver lab longitudinally. We have some radiology built into our curriculum. Some schools are pass-fail. So definitely look into that and see what fits your needs. On top of that too, looking at medical schools that are academic and have research opportunities is a great way, especially if you know you're interested in IR. Looking at schools that have associated IR programs, IR attendings or faculty is a great way to kind of set yourself up for success going into medical school. Next slide. So you're interested in IR as a pre-med. Beyond getting into medical school, what are some things you could do now? Well, I just discussed doing research, clinical experience, and mentorship in undergrad is a great way to bulk your application up for medical school. You can seek out these opportunities in interventional radiology. Doing IR-related research, if you have access to those providers, is a great way to get more exposure to the field, and those relationships can transcend past your matriculation to medical school. Same with clinical experiences and mentorship. And mentorship also doesn't have to come in the form of an attending doctor. I have great residents who are mentors to me, even 3rd and 4th year medical students as an undergrad. maybe the leaders of your IR interest group at your local medical school. The last thing I would say is definitely understand IR. There are resources out there on social media. So the SIR RFS publishes case reports and infographics on different procedures IR does. We have a virtual shadowing program geared towards undergrads and medical students that goes through specific cases. If you want to get involved in IR as an undergrad, shadowing is a great way, but also we've discussed social media and conferences is really one of the best ways to get your name out there and get involved. I had so much more time as a second semester, fourth year undergrad to go to SIR, which is in March, than in medical school. And you can really get to know people and get your name out there and then foster those connections online afterwards. Yeah. Next slide. So this is actually the undergrad symposium we have coming up in a couple of weeks. It's one day. There'll be some more specific talks on preparing for the MCAT, what IR is all about. So I definitely say if you're interested as an undergrad in IR, that's a great way to get more exposure and build some more connections. I'll hand it over to Marvee for the medical student section.
All right. Hi, everyone. So for those who I haven't met last night at the meet and greet, I'm Marvee. I'm a fourth-year med student at Beaumont in Michigan. First of all, I'd really love to thank the organizers of this event and Dr. Reed for really thinking of me and giving advice to the future VIR physicians. I'm just very humbled to be speaking to everyone today. My advice is really geared more towards medical students, and I decided to break it down based on these major areas, which I believe are really key factors that's going to make up your application for residency. And I also broke it down with regards to every year of your medical school training. Next slide, please. So for your first and second year of medical school, your main priority should really be building on your clinical foundations. Your goal is to become a clinical VIR physician, so focus well on doing well academically and really learning the basics. So this includes anatomy and physiology, your biochemistry, microbiology, pharmacology, and organ systems. And during these years, it's very easy to fall into the trap of thinking, I'll never use this later in medicine. And this mentality is really a mistake because in order to really truly understand the diseases and to really care for your patients and understand the clinical management of your patients, you really have to have a solid understanding of these foundational topics. It makes it easier when, to understand why you're using certain medications when you're managing your patients. For instance, if you're using this certain type of antibiotic versus another when you're managing GI infections versus like a superficial cellulitis on the skin. So really make sure you nail down these foundations. The next thing is you should start shadowing physicians. You really want to know what field you're getting into. And by shadowing physicians, you're also going to be opening up doors for research opportunities as well. Your main goal throughout your M1 and M2 year is you should really be studying for your future patients. Next slide. Another tip is get involved in extracurricular activities that really matter to you. Extracurricular activities that really speak to your passion. So for instance, I was really passionate about community service in terms of helping out the community, especially during the peak of the COVID pandemic when the homeless population really lacked access to medical care. So really pursue activities that's going to highlight what you're passionate about in medicine. And make sure that you pursue activities where you're going to be able to participate in a longitudinal basis. Because some students can have, 10 different activities under CV, but if you did very little and you can't really talk about it in your application, then that really doesn't speak so much to your passion. Get involved in your school's VIR interest group leadership. If you don't have one, then create one. The SIR VIRIG committee has tips on how to start, VIRIG organizations at your school. So definitely get started on that if you don't have one at your school. The SIR MSc committee also has a ton of research projects that you can participate in during, your early career in medical school. Attending a VIR conference like what Satya said in his talk with regards to SIR, ICET, CERSI, would definitely open up doors with regards to making connections with attendings, residents in the field. You can submit educational abstracts or research abstracts. And also, I know that a lot of these conferences can also be pretty expensive. apply for the medical student travel scholarship. That's what I did at the end of my second year of medical school. I ended up applying for the SIR medical student travel scholarship. So that funded my ability to be able to travel to the SIR conference in Boston. And that's when I got the chance to meet Dr. Cherry, who's been a phenomenal mentor to me. And like what Satya was saying, find mentors, and there's different layers of mentorship. There's different layers of mentorship. There's upper medical students mentors, there's a resident mentor, there's attending mentors. Make use of your resources because that's how you're really going to be able to know the field that you're getting into. So build those connections within the field. And most importantly, do well on step one. Don't just pass it now that it's pass fail. You're really studying for your future patients. And, I can tell you right now that even when you're taking step two, there's sprinkles of step one on that exam. So really make sure that you focus on step one and don't just go in the mentality that you're just going to pass it. Next slide, please. With regards to your M3 year, this is your time to shine in your clinical clerkships. Apply what you've learned in didactics. Be hungry. What Dr. V is saying, Philo, be the first one in and the last one out. You want to be able to show the faculty that you're hungry for knowledge. Faculty loves to teach students who are eager to learn. Be proactive about seeing your patients. Really, really, really own up to your patients. Like, I can't emphasize that enough. You need to own your patients when you're in clinicals, know everything about them. Run errands on your patient no matter how small they may be. It might even be like changing the dressings or like taking them for a walk in the hallway if physical therapy can't see them. Be your patient's advocates. They're coming to you at their most vulnerable states. So you really want to treat these patients the way that you would want your family to be treated. And then go out of your way to really help your residents. And this includes, offering to write clinical notes on the patients that you saw, presenting during rounds. Some clinical rotations that I saw that I had, residents didn't really have much expectations of, medical students in terms of rounding on their patients. Take that initiative to round on your patients because, your mentality should be, that's my patient. You saw them the previous day. You should be seeing them every day while you're on that service until they get discharged. And then lastly, ask for letters of recommendations early. If you know that you did well in that rotation, it's better to ask for the letter of recommendation early while the attending still remembers you, so they can write, how they observed you during the clinical clerkship. Next slide, please. In terms of applying to VIR away rotations, make sure that you're on top of the requirements. And when the applications open for the away rotation, this can include a lot of, immunizations. And so just make sure that you have everything prepared so that when the application opens, all you have to do is submit it, because a lot of these away rotations are on a first come, first serve basis. I pretty much got all of the aways that I applied to because I made sure that I had all the requirements done before the application for that institution even opened. So just make sure you're on top of that. And then in terms of during your away rotations, apply for scholarships as well, because away rotations are not cheap. You're going to have to think about housing. You're going to have to think about your flight there and having to pay for your rent at your old apartment while you're renting, another place at whatever institution you might be in. I applied for the SIR GEM scholarship, which funded one of my aways with Dr. V in LA. So if you qualify for that, definitely apply for those. There are also institutional scholarships that you can apply to depending on the institution. So make sure you look into that as well. And then my piece of advice with regards to your personal statement is have a draft by like May of your M3 year, because you're gonna be busy studying for your step 2 exam, and you're gonna be preparing for your away rotation, so you're not really gonna have a lot of time to really like sit down and focus on your personal statement. So just make sure that you take care of that before all of these other things start to happen. So all you have to do after you take step 2 and when you're doing aways is just editing and editing and editing your personal statement to make sure that it's perfect before you submit it. And then lastly, crush step 2. I can't emphasize that enough, because now that step 1 is pass fail, you really need to do well in step 2. Next slide, please. During your M4 year, with regards to your VIR away rotations, again, the same mentality applies. You want to be the first one in, last one out. Know your patients, know the cases that you're going to be doing for that day. Be first assist in the procedures that you're doing. This is very resident and attending dependent. When I rotated with Dr. V, I had a phenomenal experience, you being really, really hands-on. Know your VIR tools. And also one tip of advice that I would give to everyone is I always studied the films of the procedures that you did that day to make sure that you really understood the procedure that you just performed. The more that you look at it, the more that you're going to get better at reading the angiograms. Don't forget about your clinical knowledge when you're in your VIR rotations. Some of the, away rotations that I didn't have expectations for medical students to round on the patients. Be proactive about that. If you did a procedure on that patient, you should be rounding on that patient the next day. As for clinic, I particularly did this for one of my away rotations when they didn't really have medical students, go to clinic with the physicians. I see it as your away rotation should be, you're auditioning for that away rotation, but you're also interviewing that program as well because you want to make sure that they're the right fit for the kind of person and physician that you want to be in the future. So if they don't have medical students, follow them in clinic, ask for it, and they're more than happy to let you, follow them in clinic. And then lastly, ask for a letter of recommendation if you did really well in that away rotation. With regards to other rotations during your M4 year, definitely do rotations that are related to VIR. This includes your surgery sub-I, your SICU, MICU, vascular surgery, diagnostic radiology. I think it's very easy to, walk into fourth year and, just kind of, put your hands up and be like, I'm done. I just want to take the rest of the year off. I think that you should really use that time to really prepare yourself for residency. This is your time to really take a lot of those electives that's going to be helping you in your career as a future VIR. And then with regards to applying to residency, make sure you do your research on the residency programs. Talk to your colleagues, talk to mentors about the program because there's so much variety with regards to how clinical the VIR training program is. Definitely talk to mentors about it. They could say that they're very clinical, but if you talk to the residents and they're not really taking part in clinic, they're not really following up their patients longitudinally, then that's not really a clinical program. And again, just make sure you're on top of the deadlines when you're applying for these residency programs. And that's it. And we'll take any questions if anyone has them.